Okay, good. I think we can begin. Hello everyone, welcome to this Stats Café. My name is Petra Nachmias and I'm Chief of the Population and Social Statistics section here at ESCAP Statistics Division. And I'm very, very pleased to welcome you to this Stats Café to mark the launch of the new guidelines on estimating completeness of civil registration of births and deaths. Before we start, some quick housekeeping. We've moved to a new format which has disabled audio and video for non-panelists. If you do have a question for the panelists, we would ask if you could kindly write it in the chat, which we'll be monitoring throughout the event. So just to quickly give you some background, these guidelines have been developed as part of a larger project on improving inequality assessments of CRVS systems. Conducting inequality assessments is one of the implementation steps of the Regional Action Framework of the Asia-Pacific CRVS decade, one of the commitments that countries have signed up to. But we saw in our midterm review of the decade that very few countries were managing to do these assessments. It was in fact the weakest of all the implementation steps. So we realized that ESCAP and the development partners needed to do more to support countries in meeting this key commitment. A crucial component of a quantitative inequality assessment is being able to estimate completeness of the vital events, both nationally, but also for the different population groups. The COVID-19 pandemic has only highlighted the urgency and necessity of this work. How can we estimate basic metrics such as excess mortality if death registration data are not complete, and even worse, if we do not know the extent to which they are not complete and for which population groups? So we hope that these guidelines are one of the ways in which we can help fill this gap by providing more guidance on how to do these estimations. We do invite you, following this Stats Café, to look at the guidelines and especially to try out the tools. And please do try and break them as well by testing them out. If you do see anything that you think that needs to be flagged, then please, any feedback will be most gratefully received. So in today's webinar, we will shortly watch a short video on the guidelines, and then I will invite our consultant who has developed these guidelines, Professor Tom Moultrie from the University of Cape Town, to provide us with an outline. We will then move to some country experiences in estimating vital events, and I'm very happy to say that we have a wide variety of experiences to share here today from Georgia, Bhutan, Australia and Bangladesh. So since time is short and we have lots of material to cover, I will request from our team here to please play the video and then we will go straight to Tom.
There is no sound, Pandita.
Benita, don't worry about it, though. The sound's just music. So maybe we can just move ahead. Thanks, Panita. Apologies for the problems with the sound. We'll put it onto our website so you can also watch it with the background music as well. So with that, I'll hand over to Tom.
Good morning, all, and thank you very much, Petra, for your very kind introduction. So there are a lot of country experiences to be discussed this morning in the Stats Cafe, and so I don't want to take a lot of time, but I want to give just a slightly broader overview as to what these guidelines are, which you saw mentioned in the video. And so what we're going to be doing this morning, I'm just going to give some very basic background and context for the guidelines. And the first thing is this idea of the imperative for improving the completeness of civil registration. We all know that the SDGs have a mantra about leaving no one behind. And the SDGs makes explicit mention of birth registration and identity management for all people on the planet. But the idea of leaving no one behind goes far beyond that. In terms of, as Ms. Namias just mentioned, how does one understand the burden of mortality, for example, arising from COVID, without a complete civil and vital registration system. And so within this, and as Ms. Namias mentioned, within the ESCAP project about the decade for improving civil and vital registration data in the region, the midterm review identified capacity constraints within countries as to how to go about evaluating the completeness of their CRVS data. So what we have built here is a set of guidelines. This is a text document which was linked to in the video and which are available on the ESCAP website. But it's structured as a hands-on resource for practitioners. And by hands-on, what we've done is we've also provided an associated Excel spreadsheet that implements many of the methods and the approaches described to try and make it as simple as possible, at least to get off the first base of how to estimate the completeness of birth and death registration. So in terms of the contents, what we cover are general tools for working out or adjusting the numerator, that is the estimated, the reported number of events in the CRVS system. In some countries, we know that there are significantly delayed registrations, perhaps extending out for several years after the event occurred. And so we present a well-established actuarial method for adjusting those reported events in anticipation of future events which have occurred, which have not yet been reported. We also talk about the need for adjusting for events which are not late, but which occur in the following year, because that will affect the count in the numerator of the events which have occurred at any point in time. We spend a lot of time talking about the choice of an appropriate denominator. What do you compare your registration statistics to? Data from a census, from a population projection, and importantly now, particularly in this period of COVID, to consider the impact of COVID-19 on estimating completeness. There's significant and anecdotal data about the impact of COVID-19 on fertility patterns and trends, which will affect the number of births in the last couple of years. And obviously, there's been a significant burden of mortality from COVID-19, which is going to affect your choice of the denominator, and that needs to be taken into account. So when we talk about birth registration completeness, we, as a generic version, we look at the comparison of birth registration data with the UN World Population Prospects, the 2019 edition, as well as the other estimates of births. We present methods for using data from a census and the application of a reverse survival method to estimate previous numbers of births from that census. And we talk about the use of fertility rates from other sources, surveys, mixed surveys, DHS surveys, to population data, as well as the possibility of using data from administrative sources, school enrollments and child vaccination data to try and get an estimate of birth registration completeness. In terms of death registration completeness, again, we have implemented a mechanism to do a direct comparison with data from the UNWPP, as well as other estimates, say from national population projections or subnational population projections, and as well as describing some fairly well-established demographic methods for estimating adult death registration completeness from census registration data. So the idea behind these guidelines is to offer a tool that will help to address that capacity gap within the region and hopefully in time beyond the region in being able to estimate the completeness of civil registration of vital events. And as Namias mentioned, we hope that this is going to become a living document, enhanced, augmented, and developed through the feedback of its users to really help address that capacity gap both in the region and elsewhere. There will be a training workshop starting later today where we step through the guidelines in full and in detail, and hopefully that will provide more feedback and more scope for improving these guidelines. But in the meantime, I'll leave it there and leave it to the in-country representatives to give their presentations. Thank you very much, Petra.
Yeah, thanks, Tom, for that outline. I know that there is so much more in there, so please do peruse through these guidelines at your leisure, and I'm sure that you'll find a lot more material. Next, I'll move to Mr. Sharana Tiklauri, who is head of the Population and Demographic Statistics Department at the National Statistics Office of Georgia, as well as one of the members of the ESCAP Regional Steering Group on CRVS. We're always pleased to have Georgia presenting, and we're always happy when they agree to share their experiences since they've made such impressive strides in improving their CRVS systems. So I will hand over to Sharana.
Good morning, everyone. Thank you so much, Petra. Can you hear me?
We hear you well.
Good. On behalf of the National Statistics Office of Georgia, I'm honored to thank ESCAP for being here and sharing Georgia's experience in estimating the completeness of vital events. Georgia is a small country in the South Caucasus region with population 3.7 million only. Migration has always been the main component of the population change in our country, but in 2020, positive net migration was observed, which for the first time in almost 40 years, which could be explained by the pandemic restrictions. At the same time, in 2020, we had negative natural increase due to huge numbers of deaths. About the main demographic indicators, last decade, the infant mortality rate is characterized by downward trend and equaled 8 deaths per 1,000 live births in 2020. As the total fertility rate, it's changed very slightly and equal 2 children per woman. Life expectancy at birth increasing 2 points in comparison to 2010 and reached 69 for males and 78 for females in 2020. The proportion of persons aged 65 years and over equaled 50% in 2021. The production and publication of vital statistics is mainly dependent on the completeness of civil registration. This slide shows the registration system of births and deaths in Georgia starting from 2017. Georgia has highly developed online registration system. It should be noted that since 2011, the medical certificates are filling electronically. If birth or death occurred in the medical institutions, they fill out medical certificates and automatically send to the Public Service Development Agency for the registration within 5 working days. If birth or death occurred outside of medical institutions, the representatives of the local administrations makes a statement of death or birth or based on the information provided by family members or others, and they are sending this notification to the agency within 5 working days. It should be noted that any non-receiving or delay registration notification to the Public Service Development Agency and with which a penalty. In Georgia, registration of birth and death is free of charge. Starting from the 2017, Geostat receives the number of births and deaths individual databases from 2 administrative sources. It is NCDC and PSDA. We are merging this data using medical certificate numbers as well as, if needed, personal identification numbers, names, surnames, date of birth, and other indicators are also used for linkage. Integration of the data helps to improve the quality of data as well as coverage of the vital interests. At the end, final vital statistics includes number of births and deaths for both sources as well as numbers of births from the NCDC only or for the PSDA only. The current the current part, one of the source for the, as I mentioned, one of the source for complete calculation of the vital, of the completeness of vital events is UN's World Population Prospects. Which includes a long time series, and it is good, as well as the estimates are made accordance with international standards, which make data more comparable and accurate. But it should be noted in our cases that this data has its limitations. The matter is that the number of population covered by official statistical data and by UN data is not the same. The matter is that UN covers the number of births and deaths for the occupied territories as well, but unfortunately official statistics is producing only territories covered by Georgian government. So if we calculate the completeness rate for the last 5 years, we can see that completeness rate of births is more than 97%. The current pandemic is disrupting CRVS system all over the world, but well-functioning registration system are more essential than ever. It is worth mentioning that despite registration of vital events is being disrupted by lockdowns and social distancing measures, Geostat is publishing all the data on time without any delay. The COVID-19 did not much have impact on the registration on vital events, as far as majority of registrations, including births and deaths in our country, were available online over years. You can see from this slide that in 2020, months of live birth and registration for 92% don't differ from each other, and it is very good results. It is the same for the deaths. In Georgia, for calculation of the completeness, one of the sources we are using UN World Population data, and you can see that completeness rate for deaths over last 5 years, it is 94%. And I should be noted that I calculated for 2020 as well, and it was almost 100%. But it should be noted again that these two numbers are covered different numbers of population. So this percentage should be a bit less. It is the same. For this, we don't have registration delays. So in 2020, for 92% of cases, months of test and registration don't differ from each other. Thank you so much. I'm very happy to answer your questions, if any.
Thank you, Sharona. We'll take questions at the end, but I've got a few myself, so but let's see if we have any questions we get from the audience first. That was very interesting. Next, I'd like to invite Mr. Tashi Dorji, who is Chief of the Social Statistics Division of the National Statistics Bureau of Bhutan. Bhutan has prioritized strengthening the use of administrative data, including CRVS. And indeed, last year they published their first vital statistics report, which was a landmark achievement, with obviously completeness being an essential component to being able to assess the applicability of those results. So I will hand over to Tashi. Are you there? Okay.
Share my screen. Yes.
Yeah, sorry, it's frozen.
I'm looking for my file. Okay. Can you see my screen?
No. Would you like us to share from our side?
Yeah, sure. I think I have some problem here. Yeah.
Okay.
Okay.
Okay. So
well,
we'll just put it up, and you just tell us when you want to go to the next slide.
Okay.
Pim, we need to make it into presenter. Yeah. Great. Thanks.
Okay. Thank you. Also, on behalf of the National Statistics Bureau, I would like to thank the ESCAP for inviting us to share our experiences in estimating the completeness of the vital events in Bhutan. So, as Petra mentioned, Bhutan just started publishing the vital statistics report starting last year. So whatever I'm presenting here today is based on the first vital statistics report that we have published so far. And the initiative has been taken by the National Statistics Bureau as elsewhere. So this is the practice. And I have, in accordance with the guidelines provided by the ESCAP, so I will not take much time. So I have very few slides. Next, please. So I will basically talk on the background as how we started working on this vital statistics report, and then I will touch upon the data source for the vital statistics report and the key findings from the report, which is on the coverage and the completeness of the vital events in the Bhutan, which I think is the main crux of the event today. To start with, so National Statistics Bureau, in its effort to strengthen the improvement of statistics in the system, so we started giving importance to the use of administrative data, including the CRVS, use of civil registration and vital events data from the other sources like Ministry of Home and Culture Affairs, who is responsible for compiling the information on the civil registration. So we started using their data to compute the vital events. Moreover, we have also ventured on some other administrative data to complement the generation of official statistics aside from the censuses and household service as the traditional source. So we are now giving focus on the admin data as to how we can improve and use to generate the official statistics in Bhutan. And this is also as a part of the commitment that Bhutan has made for the Asia-Pacific CRVS decade. So in continuation to that commitment, National Statistics Bureau, together with our collaborating partner, Ministry of Home and Culture Affairs, and in particular the Department of Civil Registration and Census. So we have worked very closely to fulfilling this commitment that we have made in Bangkok. That is the reason that we were able to come up with the VS report for the first time. And in doing so, we initially did not have much capacity in working on how to produce the civil registration and vital statistics report. But we were very fortunate to have this project supported by the ESCAP in Bangkok. So we started working on this with some experts at ESCAP starting 2016. So we have had a small project with the ESCAP whereby they gave us some capacity building. And in doing so, we came up with a draft report, which was shared with the experts at this ESCAP, and they have given us comment and feedback to improve the VS report. And then finally, we were confident that we can now at least come up with a report. So then we started getting the information from the Department of Civil Registration and Census. And then last year, we managed to publish the first report in Bhutan. So the collaborating partners that we have in this report are the Ministry of Home and Culture Affairs, which is the main agency responsible for maintaining the comprehensive records of all the Bhutanese citizens, as well as they also have the information on the resident people in our country. And also this is complemented by the information from the Ministry of Health, especially when it comes to the cause of death. Actually, we do not have the ICD-based cause of death, but they do have the admin data, the top 10 cause of deaths. So we use their information as well. And the third, the collaborating partner we have is the Department of Immigration, who maintains the information on the non-Bhutanese residing in Bhutan. So we also have them on board throughout, starting 2016. So these are the three agencies aside from National Statistics Bureau working on the vital statistics report. And the understanding that we have between these agencies is on an annual basis, they are going to share us the data, and this is governed by the memorandum of understanding that we have signed between especially the Department of Civil Registration and Census and National Statistics Bureau. So every year on such indicated date, they share the data, and then NSB starts working on the data. So while we work on the data, what we basically do is we look at all the variables that are being captured by the Department of Civil Registration and Census, wherein we check the complete whether the information they have collected or compiled are all complete or not. So for some cases, although the births are being registered, but there are some information that are missing. So in the report, we have not been able to capture those events where the informations are half complete. So that's why some very less percentage of the births is not included in the report. So we have taken only those births where the information are complete. And for the report, we have also referred to the recommendations of the principles recommendation of the civil registration published by UN, and there are a number of tables that requires to be published, but for the reasons that most of these vital events are not being compiled or captured in Bhutan. So for these reasons, we started with working on the births and deaths only. So whatever information that you may see in the report is purely based on the births and deaths that we have. And the third thing is on the coverage, basically the findings. And then, as I mentioned earlier, I'm just going to talk on the coverage and completeness. Next slide, please. Yeah, and on this slide, you see the map of Bhutan and all those triangle points that you may see on the screen is the registration points. So I'm talking on the coverage. So in terms of coverage of the civil registration, we have no issue. So it's almost 100% coverage. So we have reached almost all the nooks and corners of the country. So actually, the lowest administrative label in Bhutan is the block, which we call the geok. So we have around 205 geoks, and for all the geoks, we have the registration points. And aside from the 200 geoks or blocks, we have 20 districts. So we have all these registrations point located at all these important centers for the ease of our people to go and register at any point in time. So in total, there are 230 registration points, and this makes our people to register their events, both births and deaths, easy. And most of our people go to these centers or points to get registered. And also for some people who may be not within their administrative boundary, but they can also, if they are in the separate or in another district, they can also like process their registration from the place where they are residing. But the only thing is they need to get the documents verified from the respective administrative authorities. So this is how the registration is being done. And in terms of coverage, as I mentioned earlier, it is almost everywhere in the country, including the remotest part of the country. So we have no issues with the coverage of the births and death registration points. Next. So now coming to the completeness. So as elsewhere in the country, I mean, like in the region, so we do have the issues when it comes to the completeness. Not all the events that is happening in the country gets registered in the same year or within the prescribed years. So that's what like we have. But I think over the years, it is improving both in terms of death as well as birth registration. So on the current slide, what we see is the timeliness. This is not the completeness, but the timeliness of the events getting registered. So for the births, I think if you look at the blue column, I think it is a very progressive in terms of the timeliness of our events getting registered. So for 2016, it was just 91.4 percent of the births that happened were registered. So gradually 2017, 18, 19. So in 2019, excuse me, 98.3 events births are registered. So in terms of timeliness of the births, I think we are improving over the period. And likewise, even for the deaths, although we have issues with regard to death registration, but looking at the timeliness of the registration after the events have been occurred, I think it is improving as well. So that year that we have mentioned here on the screen is 2016, starting 2016 to 2019. So that is the, I mean, like, we started working on the VS report and we have the data starting 2016 because that is the only year that we can go back, because prior to 2015, I mean, like, the data was not in the system, so it was very difficult for us to look into the data. So only starting 2016, the Department of Civil Registration and Census, they have compiled in the very, I mean, like, systematic way. So that was the reason that we started working starting 2016. And for the death, if you see in 2017, I think the timeliness was quite low. But for this, I think we have no reasons. But if you look at the trend, I'm just indicating that, okay, for that year, it was a bit low. But then thereafter, the events that was happening on different years are getting registered on a timely basis. Okay, next. Here we are presenting the matrix of births by year of occurrence and year of registration. So if you look on this table, so one side it is the year of occurrence of the births, which is 2016, 17, 18, 19, and then on the horizontal we see the year of registration births, which is 2016, 17, 18, 19, 20. So in 2019, of the total 9,667 births, I think almost 90% were registered in 2019 itself. But because the time that we give for the people to register is the 1 year duration, although the standard operating procedure says the births or events, both birth and death, it should be registered 1 month after the events have occurred. But I think this is more or less relaxed, but not later than 1 year. So they have to be registered within the 1 year time period. So that's why, like for 2019, of the total births that happened in 2019, which is 9,667, 5,463 births were registered in the same year. And there is a delay of, I mean, like, not delay, but some are being registered in 2020 because for the reasons of the 1 year time period, because some births that may have happened in 2019, sometimes November, December, so that will still go for the duration of 1 year, means it will go to November next year, so following year, which is 2020. So that's why, like, we see this some getting registered in the same year, but some goes to the following year. So that is the reason that we see some births getting in the following year. Likewise, if we look at the year of registration, see in 2019, of the total births that were registered in 2019, which is 10,212. So that is, some births are that happened in 2016, 17, 18, 19. So that is the matrix that we are presenting here. So this is how it is happening. So, but what I wanted to say here is that most of the events that occur in a year is getting registered in the same year. Okay, next, please. And it's the same for the deaths. So I think no separate explanation is required because it is almost same. So there's nothing different except for the events, which is the previous slide shows the births, but here it is the death. So the matrix is same. So we see in 2019 of the total deaths that we have occurred is 3,220, of which the most of the events 2019 2,654 were registered in the same year, so which occurred in 2019 and registered in the same year. So I think in terms of the year of occurrence and registration, we are doing quite good as well. But as I mentioned earlier, compared to the births, we have issues in terms of death registration because especially for those children below 8 years, it is very difficult to make people register because there's no incentives being provided by the government for those dates, which is happening for the ages 8 years and above, since there is insurance tagged along. So people register, so because they have to produce the death certificate to claim the insurance. So that's why it is required for the people to register all the deaths above 8 years. But below 8 years, I think it is not mandatory, but so long as there is incentives, people don't register. So that's why we will have, if you look at the by age, incompleteness would be very high below the 8 years of age.
Actually,
okay, next. Yeah. This
is super interesting, but we've gone quite a bit over time. Would we be able to wrap up, please?
Okay. Okay. I think I'm almost at the end of the slide. Yeah, so this is the completeness overall. So 2019, the birth registration completeness is 78%, and for the deaths it is 63. So for the reasons that I've mentioned earlier, so you see the deaths is very low in terms of completeness, and birth it is we are almost doing good, but we are not there. Okay, so I think this is the end of my presentation. So if you have any questions, I can take. Thank you.
Thank you so much, Tashi. And next speaker is Ms. Lauren Moran, who is Acting Director of the Mortality Data Centre of the Health and Vital Statistics section of the Australia Bureau of Statistics. I'm very pleased we have Australia presenting, because it's important to note that estimating completeness for all population groups is important, even for a high capacity system. And inequality assessments should be periodically carried out by all countries to ensure that universal registration is really universal in capturing everyone. So Lauren, over to you. Thank you.
Thank you. I'll just move over hopefully to the right share tray. Oops. Can you see my slides now?
We did, but they just moved.
Yeah, they just keep
disappearing.
There they are. There we go. Okay, thank you for having me to talk about the Australian experience of estimating the completeness of vital events. So in Australia, the Australian Bureau of Statistics generally does the estimations. We're a federation here, so we collect information from the 8 states and territories and put it together to try and get a national picture of what's going on. And registration for births and deaths is really very important to us, both from that individual perspective for the identity and ensuring that the rights that go along with that are recognised, but also for the statistical part of it. So it really does form all of our foundation for our population statistics and many of our health statistics as well. So we have really high rates of registration for both births and deaths here, generally in the higher 90%. But what we do know about that small percentage that we're missing is that they do tend to be populations who may be at risk for health issues, they may be of lower socioeconomic status, or it could be some groups who aren't able to access the forms or access the system in a way that supports them to complete the registration. And so I'm just going to cover off a couple of examples of how we've estimated the completeness for some of our specific population groups that we know are at risk here. So the first is Aboriginal and Torres Strait Islander people who do tend to live in remote and very remote areas, and other people who can be from culturally or linguistically diverse communities. And I'm just going to cover off a little bit as well around coroner referred deaths, because we've got a younger population there. And so measuring completeness can be very challenging, and really trying to work out who we have and who we don't have, and we have to go to quite a number of different sources. So we do know that we can have a look at other measures such as birth notifications or medical certificates of causes of death, but whether it gives us the right information about the population that we're trying to understand more about and trying to work with the registries to develop some registration strategies on is the big thing with using these other sources. So every time we go about estimating the completeness, what we do is we apply really this known unknown matrix. So with the known matrix, so our known registrations are obviously the registrations that are received by the Australian Bureau of Statistics. We use that as the basis to build all of our denominators, and these are the people that we know about. And we've got high control in that area, which is why we're so interested in that group in informing how we can take other things forward. So another group is our not registered, but we're aware of the vital event. So this is where we can see that there's a birth notification or a medical certificate of cause of death, or even a coronial case, but there's no corresponding registration. So something hasn't gone right with the completion of the case. So we don't have it to count. So we have a little bit of control in this area. We're aware of the event, but we're not able to count it. But we can see the gap there. So another area is our unknown registration. So because we're collecting on behalf of all the registries of births and deaths across the country, we could have some people who were actually registered and we should be counting them, but for some reason an administrative issue or a system issues occurred and we haven't gotten them in the data set. So they're quite high risk for us, even though they're very rare. It's because we don't know that it's actually occurred. So we have to put in a number of checks to try and be on top of that. And of course, our most at-risk group are the group who aren't registered and we're also unaware of the vital event. So these are harder to reconcile. So it could include a home birth where there's been no information sent to the registry, there's no corresponding birth notification. We do know that there can be some populations who are disproportionately affected by this. And this is where we keep trying to zero in on, can we find out more about these people to have a really accurate estimate of our completeness? So last time when we completed the form, we had a real interest in our Aboriginal and Torres Strait Islander population. We have a lot of campaigns that our registries run here, really trying to work with the community to help with the registration rates. So we were very reliant on that known registration component of our known unknown matrix for this group, and we really relied on our historical data to help inform our gap. And so we put together a cumulative graph to try and work out what was going on. And what we can see here is what we could tell from it all was that within 90 days, we had about 70% of our Aboriginal and Torres Strait Islander babies registered. It was 90% for the non-Indigenous population. And then it was cumulative from there. So another 11% by the end of the year. And of course, it just keeps going down for the non-Indigenous population. But then we had a real burst again at that 2+ years. So this is where we realised there was maybe some contact with school or daycare or team sports, things like that, where a birth certificate was actually required, and so mum and dad might go back to the registry. So the historical data was really, really key for helping us work out the gap here, and we've been able to share this information back and forth with the registry. So for our deaths referred to a coroner, so these are more likely to be young people, people who have died in unnatural events, so it could be suicide or assault, and a lot of at-risk population groups. So we use not just our historical data here, but we also have a coronial case system, and we would have a look at who appeared on the coronial case system in a given month and how long did it take for their registration to come through. So it's a bit of a messy table here, but if we look at January 2020, based on our coronial case system and our registrations, we could see that within a month we had about 28% of people on our coronial case system. Within 2 months, we were getting up to 80%, and then it keeps going up a little bit each month, but really still takes over a year before we're filling in the gaps. And of course, what we're still missing every time is the unknown group. So we could still be missing them completely from this table, but hopefully it's quite minimal. So how are we going to use what we did last time to really inform how we fill out the completeness next time around? So there's been a lot of talk around COVID-19. We've also done a lot of work, and there's been a lot of support with COVID-19 to have access to faster information. And we've been able to use this to really give quicker estimates on our completeness. So when we were asked to output data monthly, which we used to do annually, we started reporting on our completeness rates every month. And this has really helped us to identify what they are and where we think some of our gaps could be. And so what we realised was after about 2 months for our doctor certified deaths, we had about 95% completeness and around 80% completeness at the same point for coroner referred deaths. So we've been able to take this back to the registries and work really closely with them around how can we keep working on that completeness and also the timeliness aspect, especially in that coroner referred death space. But of course, we're still with this approach missing that unknown group of people. So where we don't know that they had a vital event, and they also just don't know about them at the registry as well. So something else that we're looking at the moment is data linkage. So we have been working with one of the registries here in Australia to link in the births data to something that we call the multi-data integration project. And this is a big data set which has census data, tax, social security and Medicare data. And we're going to link the births on there and have a look at who doesn't link. And that linkage group who are on there who don't have a birth registration, but are on this other data set somewhere else, are of particular interest to us. So we're wondering, could we identify our completeness by seeing, okay, did mum and dad maybe have to go to the hospital, so they've used their Medicare card, or have they had to access some social security, so maybe the baby is appearing on that spine instead of our birth spine. So we're going to try and have a different aspect this time to trying to really find that unknown group in that unknown matrix that I've pointed out before. And it could be one of the solutions to how we look at completeness in the future, but we'll see what comes out. But that's really all I wanted to talk through quickly today. So I'll hand back because I know we're doing questions at the end as well. I'll just stop sharing.
Thank you so much, Lauren. Finally, our last speaker today is Mr. Monudin Haider, who is an assistant scientist working on public health and demography at the Researcher Institute ICDDRB, the International Centre for Diarrheal Disease Research in Bangladesh. And he's recently published some very interesting work on estimating adult death registration completeness in the MATLAB region of Bangladesh, and will share with us some of the findings. So Moin, over to you.
Thank you, Petra. Just give me a second to share the slide. This one. Do you share my see my slide, Petra?
Yes, if you want to put, that's fine now. Thanks.
Okay, thank you. Respected audience, and greetings from Bangladesh. And thanks UN Stats Café for inviting me for the presentation, for presenting my study. Here you see, this is a very simple study. We tried to understand the completeness, correlates, and possible obstacles of death registration in Bangladesh. Death is one of the components of vital statistics, and death rates or mortality rates are important measures of health and well-being. But utilizing the measure for health and well-being purposes needs precise counting of the event. Civil registration and vital statistics system provides the platform of complete counting of vital events. Now, let us look at last 3 years. This is the beginning of the year 2020. The world was shaken by COVID-19 pandemic. Definitely, there was excess mortality. However, the magnitude of the excess mortality was not known well. Developed countries estimated the excess mortality using data from their CRVS system. In contrast, most of the low and middle income countries are lacking a functional CRVS system. They had to rely on rapid surveys, which was a pretty undoable job during the COVID-19 period due to restrictions in movement. A functional CRVS system with complete death registration that provide mortality estimate by age and sex, and for small areas, and thus helps health policy planning. The low and middle income countries in general lack this advantage, and also lacked during COVID-19 period. And due to all these importance and necessities, the Sustainable Development Goals also incorporated the importance of death registration by introducing in one of its goal, partnership to achieve the goal. The goal has has an indicator, the percentage of countries that have achieved 100% birth registration and 80% death registration. And not only this indicator, count of deaths provide numerator and denominator of several other SDG indicators like neonatal mortality rate and maternal mortality ratio. Now, in the case of Bangladesh, Bangladesh enacted a Birth and Death Registration Act in 2004 and implementing this since 2006. And according to the Act, the country people need to complete a birth or death registration within 45 days of the event, and there is no registration fee within this time period. After the time period, there is a late registration charge, which is less than $1 USD. The country is also a signatory of the Asian and Pacific CRVS ticket and has committed to get everyone in the picture through CRVS. However, in the country, according to Bangladesh Demographic and Health Survey 2017-18, only 25% of under 5 children get their birth registered to the national CRVS system. And this is more frustrating when we look at the death registration, only 12% according to statistics in 2015. And we don't have any subgroup estimate, and reason of registering a death or leaving a death unregistered to the national CRVS system are still understudied, or we don't have any precise or good estimate and information regarding this. So we have our objectives in this study to estimate the completeness and correlates of adult death registration in a rural area of Bangladesh. This is in a surveillance, health and demographic surveillance system in Matlab. And then we also aim to explore potential barriers and enablers to death registration. This is as reported by family members of recently deceased adults. As I have already said, the study was conducted in Matlab Health and Demographic Surveillance System. We conducted a survey in July 2019 to March 2020. This was a cross-sectional survey of around 2,500 households to estimate and validate adult mortality. Studying the death registration was a secondary objective of the study. We used recent household death module of the demographic health survey program and added questions on death registration to collect data on death registration for recent deaths. We recorded around 626 deaths, analyzed 571 adult deaths. We excluded 25 child deaths and 30 deaths that occurred outside the HDSS. We also interviewed the outmigrants, so we have some deaths outside the HDSS. Here is the key findings you see. We find only 17% of deaths, adult deaths, were registered to the national CRVS system. Here we consider 15+ deaths as adult death. And where 26% of male deaths are registered to the CRVS system, this is only 5% for the female. And if when we look at the correlates, we see there is difference by wealth quintile. Poorer have low death registration. And one positive side is we see a change over time, that is an increasing pattern over time. And the death registration completeness for female is so low that we hardly have anything to talk about their correlates. If I summarize the finding, before that I also mentioned that we had 25 child deaths that we excluded from the main analysis, and we examined that none of the child death was registered to national CRVS system. And the summary is we see that death registration is very low in the country, and there is high gender gap, which remains significant after the controlling for other factors in a multivariate logistic regression model. And this is also true for true by wealth quintile. This is death registration is very low among the poor. And the increasing pattern and the significance get lost in the model, in the regression model, but we still consider this as a positive sign that at least there is a pattern of increasing death registration in the country. And other two important findings are we examined the reasons of registration, and here we see inheritance is the dominant reason of completing the death registration of a recently deceased of the household. And although the sample for female is very small here, still we get a similar pattern. So it looks, this is the main reason, this is the dominant reason, inheritance. And not knowing about death registration or not knowing the importance of death registration appear to be the reasons of not completing our death to national CRVS system. Now, I am explaining two important findings from this study. One is low level of death registration, and from the reason of registration or not registration of the death, we see legal reason. People are completing death registration for the deceased member of the household, mainly for legal reason when they are needing this. And also unawareness of the death registration and its importance are the reason of leaving deaths unregistered to national CRVS system. In addition, we find that I haven't explained it in other slides, but we know that we don't have any facility notification system for death registration, and we have a weak community notification system. There is a community notification system. The reason I am saying this week, that the responsible persons of community notifications are family welfare assistant, health assistant, and village police. All of them are staff of different ministries, and there are lack of inter-ministry coordination. And we also have challenges regarding vacancies of these posts. And although we have identified unawareness of death registration and its importance as a reason of leaving deaths unregistered, we are not sure if we can improve the awareness level and the death registration will be improved, because most of the deaths are still get registered for legal reason. And the other important finding from this study is high gender gap. We find that inheritance is the dominant reason of death registration. We are bringing here two examples. Land ownership, one of the most important inheritance issue. Only 13% of the women in this country have land ownership, partially of or of their own, and this is 70% for men. And another important reason of death registration is pension, but very few women work in formal sector, so that is not a good reason of registering a female death in this country. That was from the study, but I also bring here 3 stories where there are programs to increase death registration. Sri Lanka established a facility and community notification system and achieved almost 100% death registration. And there is a study in Agincourt, South Africa, that indicates that financial incentive may be effective for death registration, as they found birth registration, the financial incentive effective for birth registration. And the third one is an example from Bangladesh, Kaliganj model Bangladesh. This is a pretty well-known model, and this model found community notification system very effective to complete birth and death registration both. But here is the same problem. This model utilized FWA, the family welfare assistant and health assistant, for the purpose, and they are the staff of different ministries. They are the staff of health ministry, whereas the CRVS system is under operation of under cabinet division. So there are inter-ministry lack of coordination, and we beyond the project, the Kaliganj model, we hardly believe that FWA or HA can be effective system. So this was, I think, all from my side. I tried to cover in 7 minutes. ICDDRB always acknowledges its core donor for unrestricted support. Thank you. Thank you, Petra.
Thank you, Moin. Maybe you want to put the link to the to your study in the chat so that people can look at it in more detail, because it is a fantastic study. I'd like to thank all the participants and presenters in this Stats Café. It's been a really fascinating set of presentations. We have gone past a little bit the time, but with the indulgence of the panelists, I would like to maybe just go for a few minutes more, because we did get some questions and it seems a shame to cut without even having a chance for any question and answer. So I hope that's okay. If you do need to go, then please obviously do so. But we do have a question for one question for Georgia, for Sharena. And it says the completeness of your death registration is very high. I'd like to know the factors that positively influence death registration in Georgia. Are there any services or incentives tagged with death registration? For Sharena,
Sorry, Petra.
Yeah.
Could you repeat your questions? Sorry.
The question was asking that given how high death registration is in Georgia, are there any incentives attached to death registration?
Actually not. I mean, the fact is that the death registration is high since 2017 when registration of death is obliged. I mean that any non-receiving on the late notification to PSDA envisage the penalty and the penalty is very high. So when we are comparing our number of registered deaths to the UN data, we can find that completeness rate is quite high. Also, we have some data sources to calculate completeness rate, like censuses, and also some surveys like MIX and other surveys, but not for death registration. It is only for birth registration.
Thank you, Sharena. We actually have two questions for Tashi and Bhutan. One of them is from Samoa, and it's asking, is the NSO separate from the Civil Registrar and Census Office? And then the second one is from Fiji, asking what happens if the birth is not registered within 1 year of occurrence? Is there any penalty for late birth registration? So Tashi, are you able to answer those questions?
Okay, thank you for the question. So I'll go with the second question first. So yes, if the child is not registered within the given time frame by the government, which by the law, then the status of the child in the civil registry becomes dropout, and then the process becomes little cumbersome. So then they have to fill number of forms and get it endorsed by the local government authorities, as well as they have to also justify their inability to register the child on time. So however, like although the process of registering becomes cumbersome, but there's no penalty or fines being imposed for the registration. So that is it. I didn't get the first question.
It was from Samoa, and it was asking if the NSO is separate from the Civil Registrar's Office and the Census Office. Are you responsible for civil registration and for census?
Okay. No, so NSO is not responsible for compiling this civil registration record. So we have a separate department which is under the Ministry of Home and Culture Affairs. So we are not responsible.
Okay. All right. Thank you, Tashi. And our very last question, I think we can just slip one more in, and it's from Malaysia. And the question is to Australia. And they're asking about the MADIP project and how has the project enhanced registration in Australia, especially for the vulnerable groups?
So it's not so much that it's enhanced registration at the moment. So it's in its very infancy at the moment. So what we're looking to see is, can we actually identify in the vulnerable groups who doesn't have a birth registration? And then the idea is that we would send some of that information back to the registry, whether that's around groups or whether that's around locations with lower registration rates, and they'll be able to do some campaigns and registration activities in those areas.
Thank you, Lauren. So I think with that we should close the session. We've gone over time, and also some of us have got continuing to the workshop on this very topic this in 20 minutes. So I'd like to thank again all the presenters for such excellent presentations. And with that, we can close this Stats Cafe. Thank you very much.
Thank you.
Thank you, Petra.
Thank you.